we go directly to the second line while waiting now for the culture and sensitivity. So to manage the cause is when the culture and sensitivity has already come and then it's favorable for a particular microorganism, and then the next one is to manage for the complication. Now you have to ask yourself, what were the different complications involved in neonatal sepsis? The first complication was neonatal jaundice. So in order for you to manage neonatal jaundice, you use the Botany curve. Is it clear? And when you use the Botany curve, you have different values at which you have to manage it. There are certain elements that tell you that when you have a bilirubin level less than a certain amount, you are not going to do any management for the neonatal jaundice. Then there's a point in the Botany curve that you can do a phototherapy, and then the last point in Botany curve that you can do an exchange blood transfusion. So depending on the Botany curve, that is a curve of relating the bilirubin level of the patient and the gestational age with the weight. Is it clear? All that you can plot it and then you manage the patient respectively on the Botany curve. Now for the electrolyte imbalance, if the patient has electrolyte imbalance, you need to know that what generally in neonates, the calcium ion level that is given, calcium ion level is given 30 to 40 milligram per kilogram. Is it clear? When you give calcium ion level, it's 30 to 40 milligram per kilogram in 24 hours, and you pass it in glucose 5%, and that glucose 5% should be the normal fluid level that you should give in a child. Is it clear? You can calculate the normal fluid level given to the child by using the Holiday-Segar method, or you can use the formula that is going to tell you that you have a certain fluid level in certain neonates. In the first day of neonate, you give 60 to 80 mils per kilogram per day. Is it clear? While and then in the next day you add just 20 mils per kilogram up to day 7, where you stop at 200 mils per kilogram of fluid per day. Is it clear? In the Holiday-Segar, what you do is that for the first 10 kilogram you multiply by 100 mils in order to find for the dosage. For the next 10 kilogram you multiply by 50 mils, and then for the last, or for the above 20 kilogram you multiply instead now by 20 mils per kilogram. So let's take an example. If a child has 5 kilogram, the 5 kilogram is in the first 10 kilogram, so it means that I'm going to give 500 mils in 24 hours, and in that 500 mils I'm going to place 30 to 40 milliequivalent per kilogram of calcium. Is it clear? Now generally the next thing is also that sodium ion. To give sodium ion in a child, you give 3 milliequivalent per kilogram in 24 hours, and then the sodium ion is only given as from 3 days of life, and potassium is only given as from 3 days of life. You don't give them as from the first day of life. Then you have potassium ion given as 2 milliequivalent per kilogram per 24 hours, still in the normal saline, never passes ion directly into the bloodstream. Okay, still giving the serum the glucose percent of the child, provided the child is not having diarrhea, because you need to know that what the best fluid that you have in diarrhea, you use a crystalloid, that is either normal saline or Ringer lactate. But if a child is just having sepsis without the point of focus being the gastrointestinal tract, in this case your best fluid is going to be glucose 5%. Now the next point after that, you need to also know that there is also another method of approximation of the level of the calcium ion and potassium ion. Generally you need to know that 2.5 mils of calcium ion correspond to 500 mils of glucose 5%. That's another method of calculating. 1.5 mils of sodium ion is going to correspond to 500 mils of glucose 5%, and then the last one is 1 mil of potassium ion is going to correspond to 500 mils of glucose 5%. So it means that you just do both, an equation. Is it clear? So if you have 2.5 mil correspond to 500 mils, what is the normal fluid intake of that child? You calculate normal fluid intake of that child, and then you place you correspond it to the 2.5 mil in that concentration. So that's another method that you can use in order to calculate the concentration of the ions. So after the dehydration and the electrolyte imbalance, the next management is renal failure. If it is pre-renal, you just have to give the fluid to the child, and the fluid that you give in pre-renal is no more Ringer lactate. The best fluid that is given in this case is normal saline. Okay, and now the last one is death. So the management of death, there's no management of death. Now we continue with the last element of the tutorial, which is the follow-up.